everything you knew about nose jobs. A new procedure is sure to bring better results. We have the Nose News. Ahead.
Sometimes after a bad accident or perhaps for cosmetic reasons, people have a nose job.
What if the procedure goes bad? Doctors are now going to a surprising source to help rebuild noses. 7's Anna Diaz shows us why this nose news is good news.
Mary Gardner was happy with the nose she was born with. She had never considered a nose job until she had an accident last year.
I had an accident where my nasal septum was deviated.
She decided to have rhinoplasty to fix her nose, but was left with an even bigger nightmare. Her nose job was botched.
They just took out too much of the septum, which left it collapsed.
It's got that boxer nose look to it where it's completely caved in here. In addition, the tip of her nose has balled up.
Even worse, it was hard for Mary to breathe, and she was embarrassed at how her new nose looked.
Every time I looked in the mirror, all I thought of is I can't wait to get my nose fixed. I want it to look how I used to look.
Rhinoplasty is one of the most popular cosmetic surgeries, with more than 150,000 nose jobs performed a year. About 40,000 of those patients will need a correction, but revision rhinoplasty is not as simple as the initial surgery, often because there is not enough cartilage left to rebuild the nose. So doctors are now going to an unusual body part to find cartilage. They're using your ribs.
The biggest benefit of the rib cartilage is we have so much material to work with that I could literally rebuild the entire nose.
Doctors simply make a small incision under the breast and then harvest and carve the rib cartilage to fit your nose.
This is the appearance of the rib after it's carved, and I use this rib to rebuild the nose.
Since it comes from your own body, there's little chance of the body rejecting it or getting an infection. Plus, it looks natural.
When I put it in the nose, it pretty much becomes part of the nose.
Using Mary's rib cartilage, Dr. Steiger was able to recreate her old nose.
I was so happy when he removed the cast because it was my old nose. I love my nose how it looks now, the profile exactly what I wanted.
Even if she does get a little ribbing from her friends about where her nose came from.
It creeps a lot of people out when I tell them that I have rib cartilage in my nose. It looks great, so I don't care.
Patients are able to return to work in about a week and resume regular activity in about 10 days. If you'd like more information, log on to our website at WSVN.com. In the Plex, I'm Diana Diaz, 7 News.